Hi, everybody. I'm Lori Johnson, CBN's medical reporter, and I'm pleased to be joined by Dr. David Perlmutter, a neurologist, immune system expert, and best-selling author. Welcome, Dr. Perlmutter.
Delighted to be here. Thanks again, Lori.
Well, we're answering your email questions that you submitted to us at newsanswers@cbn.org, and we are answering them in the order in which we received them. This one is from Cheryl. Is this similar to the Asian flu? And if so, does that mean people who had it are immune to the current virus? Dr. Perlmutter?
It is similar in that, it's a viral infection. It's a similar type of virus in many ways, but in other ways, it's actually quite different. And the immune system really responds uniquely to each infection that we get. That's one of the good things about it. It's able to imprint specifically each time there's an infection and then respond when we have that exact infection again. The downside of that is having had the flu in the past doesn't really confer any benefit to this new event. So I wish it were the case, but it does not seem to be that way.
Stephen asks, do vitamins C and D help with the coronavirus?
No one, I think, has done a specific study of C or vitamin D with respect to this particular virus. What we do know specifically about vitamin D is that vitamin D activates in the body what are called antimicrobial peptides. And that's just a fancy term for the things in our bloodstream that actually have the ability to get rid of both bacteria and viruses. That said, higher levels of vitamin D might therefore be a good thing to have. We know that really across America and many developed countries these days, people have very low levels of vitamin D because they're not eating vitamin D-rich foods, they're not getting enough sunshine. So I have personally taken to adding even more to my vitamin D regimen because I think it makes good sense. Similarly, I've actually bumped up my zinc consumption as well. Again, Lori, there is no specific study right now available to us that can say, gee, if you take zinc, that's a good defense against the coronavirus per se. But we do know that zinc has significant antiviral activity, and therefore it may very well be a good recommendation.
All right, Dr. Perlmutter. Diane asks, what are the symptoms and what is a high fever in people over 65 compared to younger people?
Well, the symptoms are actually fairly similar across the age brackets. What really is quite different is the response and severity of the event, young versus old. Although, interestingly, we learned just last evening that the CDC here in America, with respect to our cases, has shown that 40% of those individuals between the ages of 20 and 54 are being hospitalized, in other words, have severe disease. And that's certainly in contrast to what we've seen in other countries. So it means that younger people are having a more of a challenging problem with it here than in other countries. And we're going to, I think, over the next couple of days, talk about why that might be. I have some very interesting ideas. But to get back to the original question, I think we can expect that a fever of around 100.5 becomes very suspicious. Now, other symptoms that we see are, of course, a dry cough, at least initially, this fever, and even muscle aching. Now, can we have those with the common flu or the common cold? Yes, you can. What happens, though, that does tend to differentiate this infection from those two other entities is the fact that in about 8 to 10% of cases, we can have gastrointestinal issues like diarrhea and even vomiting. And the muscle achy part and the headache, I think, might be more common with coronavirus.
All right, Karen emailed us, is wearing a mask helpful if you need to go out?
That's a very good question. I think a very important upside of wearing a mask is that it will keep you from touching your face. We really don't recognize how often we are touching our face with our hands, and our hands have touched areas of potential contamination. like door knobs and door handles on cars and receiving a package from another individual who may have just coughed into his or her hand. So I think a mask in that regard is worthwhile. I think that the mask, especially these N95 masks, which are the ones that are recommended, can trap the virus, and that has both an upside and a downside. The upside, of course, then you're not going to breathe in that virus. The downside is that that virus then impregnates that mask, if you will, and therefore the mask has to be handled quite carefully. Can be re-sterilized and used again. So I think, the jury is out. I think some of the recommendations for us to not use masks by and large when we are out has to do with the fact that there aren't a lot of masks and they were trying to save those for healthcare providers. If you'll notice, however, that in hospitals and other healthcare facilities, everyone is wearing a mask. And really, these are people who likely don't yet have coronavirus, and yet they're wearing masks. You would really wonder why. And I think it's because they are somewhat protective.
Don asked, does already having a pneumonia shot help?
I think that it's probably a good idea. And why do I say that? Because, you can develop a pneumonia on top of this coronavirus, although it looks as if the virus itself is able, in and of itself, to induce a really aggressive, potentially life-threatening pneumonia. What can happen, however, whenever our lungs are compromised, is we can develop what is called a superinfection or develop a bacterial pneumonia, like a pneumococcal pneumonia. And in that respect, it would have been helpful had an individual, especially with underlying lung disease, had a Pneumovax injection or a pneumonia shot.
Dr. Perlmutter, Marcy asks this question. My husband flew back from Switzerland. He's self-isolating with me. We need some groceries. How soon is it safe for me to go?
Well, it's an excellent question. I don't know if she is self-isolating away from her husband, in which case she could go at any time. Typically it takes about 14 days to be about 96% sure that you don't have this virus. The average time in terms of incubation is about 5.1 days, meaning that half the people will manifest symptoms before that and half after that. So I think that she should look at her supply of groceries. They could certainly be dropped off at her home immediately, and in which case she could bring them into the home carefully, recognizing that she would want to obviously sterilize the plastic bags by spraying them with some bleach solution or alcohol or Lysol. But I would say the best thing for her to do is to contact somebody who could drop some groceries off.
Indeed. Well, that's all the time we have. And Dr. Perlmutter, once again, we thank you so much for your expertise, for answering these email questions.
Happy to do it, Lori. We'll talk soon.
And again, if you'd like to submit a question, go to newsanswers@cbn.org. Thanks for joining us, and we'll see you again next